Dr. Ryan Couvillion with SBA Dermatology and Plastic Surgery. Thanks for attending our virtual fall event. Now we're going to learn about mommy makeovers, which includes breast surgery, abdominoplasty, which is a tummy tuck, and also some liposuction. I would love to see you in a consult, so if you're interested, give us a call or fill out the form on this page. So you have a lot of different options when it comes to body surgery. It really depends on what your goal is. So really, I kind of look at it in two things. So one way you can go liposuction, and the other way you can do something more invasive, which is surgery. Now I say more invasive, it's more externally invasive in that there are more scars, but it still kind of covers all the same areas that liposuction can do. Generally, people who have liposuction, it's more people who have better skin quality, who want a different shape, but aren't necessarily as concerned about extra skin. People who have extra skin, either from weight loss, pregnancy, anything like that, that's generally somebody who I would move more towards the surgical side, because we got to get rid of that extra skin. It's not just necessarily going to contract. So those are usually the two kind of categories we go into when we're talking about body surgery. A tummy tuck is a surgery that does two main things. So it gets rid of extra skin and it tightens up the muscles. Now, the extra skin is usually the skin somewhere between the pubic hairline and the belly button. That extra skin that's there after weight loss, after having children, that gets removed. The other part is the part that tightens the muscles, as are abdominal contents, so all the stuff that's on the inside, the intestines, the fat that's on the inside, the uterus, all that stuff, as it gets larger, the muscles stretch out. And they stretch out in two different ways. There's a line down the middle that stretches out, but also the muscles themselves get a little bit wider. What I do in a tummy tuck is I actually tighten all that back together, and it's kind of like a corset. We put some stitches down the middle, and that brings those muscles back together, usually kind of where they started, and gives you that figure again, and also makes it so your tummy, especially when seen from the side, is much flatter. And these are things that, because the muscles actually stretched out and got wider, and that middle bit spread out, there's really no way to get that back together. You can do 1,000 crunches and it's not really gonna bring it back together nearly as well as I can with some stitches while you're asleep during surgery. You can absolutely get liposuction without a tummy tuck. It really depends on you, your body, and what your goals are. Liposuction is a great shaping procedure. It's not a weight loss procedure. It's more of, I've got this stubborn fat in this one spot, I really can't get rid of it any other way. So to do that, actually use a little metal straw and basically suck out all the fat. Now, to do that, your skin now has to shrink down to that new size. So if it's an area that's got stretch marks, if it's an area that's already got extra skin, by deflating that area, we can actually make that a little bit worse. So that may be a situation where liposuction would be good for a shape, but when you're not wearing clothes, it might not look perfect. So it's kind of, it's a trade-off. And having a liposuction by itself is absolutely doable, and it really depends on you and how you're shaped and what your skin looks like. How do you know if you're a candidate for body surgery? You're interested in body surgery. I mean, really, it depends. There are so many different options for addressing different concerns that we have a lot of different options for different people. Usually, as long as you are of a healthy weight, you don't have a lot of medical problems, and you've got some extra skin or some extra fat somewhere, you're probably a candidate for body surgery. Now, it also depends on your age. So as you get older and older, maybe not a great candidate. And the other very important thing that I tell people all the time is you have to be able to take some downtime, and you have to consider small children and lifting small children. This is a conversation we have all the time. So if you need to take 6 weeks off of lifting anything greater than maybe 10 pounds, if you've got a 20-pound 1-year-old, you may need to wait until they're a little bit older and a little bit more able to get up and out of bed and things by themselves. The downtime after a tummy tuck or liposuction or anything is usually about 6 weeks. Now, I say that downtime is 6 weeks because that's when you can kind of go back to doing anything. Now, are you able to do a lot of things before that? Absolutely. Are you still sore? Yeah. So I've had patients try to go back to work at 4 weeks that had a kind of a physical job, and they were a little bit sore and had to kind of back off a little bit. Now, if you've got a desk job, I've had other people who had a tummy tuck and they were answering emails 2 days later sitting on the couch. So it really depends on what your definition of downtime is. But I usually say to everybody, you have to wait 6 weeks before you really start working out, doing any heavy lifting, anything like that. Maximum results are usually seen at about the 3 months point. It all depends. Everybody swells a little bit differently, and we gotta wait for all the swelling to go away. It also depends on what you did. If you did a lot of liposuction, it's gonna be at least 3 months, because all of that swelling, just like when you twist your ankle, it swells up. When we do surgery, it also swells up. So we gotta give it time for all of that swelling to go away. Usually you're wearing a garment, it's got you all compressed, and it just takes some time to get there. So usually until the 3 month point, we're saying, just wait, just wait, just wait, you'll get there. And that's usually about when we start seeing pretty much where we're gonna be. Sometimes though, it takes a little bit longer than that. But especially for things like a tummy tuck where we took off a whole bunch of skin, that portion, the skin being gone, is gone as soon as surgery is done. The corset thing that I talked about with the stitches, as soon as we're done with surgery, you see that part. So you always, immediately after surgery, as soon as you wake up, there are results. But the absolute maximum usually takes about 3 months for all the swelling to come out. Results last as long as you maintain your weight. That's really the big thing. If you've had a tummy tuck and you have another child, now that's gonna change things completely, because things are gonna get stretched and you'll never be back to where you were. But sometimes patients like that have a revision. Can you have a baby after you've had a tummy tuck? Yes. Is it ideal? Probably not, because you've already had the surgery. But the body is great at stretching, so if the baby's gonna stretch the body out, it will absolutely do it. Other than that, as long as you maintain your weight roughly in the same neighborhood as you were when you had surgery, your results should stay the same. Now, as we age, if you have surgery at age 30 and you're 75, yeah, your skin is definitely gonna relax some at that point, but you're never gonna be back to where you were before surgery. How do we customize the implant size for you? Well, I used a tissue-based approach. What that means is I measure your chest, I measure how much breast tissue thickness you have, and we get an idea of what implant size will fit for you. Now, implants come in all kinds of different sizes. I help guide you picking an implant that'll fit your frame. Now, the analogy I like to use for that is the tires from an F-150 are not gonna fit on a Honda Civic, and the Honda Civic tires aren't gonna fit on an F-150. So you gotta pick implants that are gonna fit your frame and are gonna be not too wide and not too small. And that's part of the process that we go through with a sizing system to pick the implants that are just right for you. What's the difference between saline and silicone implants? Well, from the outside, the shell of the implant, the actual coating, is pretty much the same. They're both made out of silicone. The big difference is what's on the inside. So on the inside of saline implants, it's saline. It's the same stuff that we use in IV fluids. It actually, when we put it in the OR, it comes out of an IV fluid bag. Now, for a silicone implant, the inside is made of silicone, and it's a gel. That gel basically changes in different lines from different companies in how squishy it is. Some of them are really firm, some of them are a lot less firm. Now, which one do I prefer? Generally, I recommend silicone implants because saline implants have a couple of things that I don't like. They're a little bit heavier. They also have a much higher tendency to ripple. Now, if somebody has a lot of padding and they're gonna put a small implant in, it really doesn't make that much of a difference. If somebody has a lot less padding and they're trying to put in a slightly larger implant, the rippling and those edges might be a lot more visible with the saline implant. Now, there is one rule though that we have to follow, is that saline implants are allowed to be used from 18 years old and older. Silicone implants, you have to be 22 years old and older to get this silicone implant. So sometimes, if it's somebody who's a little bit younger, we may have to use a saline implant. So what incision do I use for breast augmentation? The vast majority of the time, I make a small incision underneath the breast in the fold. And I do that for a couple of reasons. For most of my patients, they don't have enough padding to put the implant under the breast. I usually need to put it underneath the muscle. By doing that through a lower incision, I miss the entire breast tissue itself, so I don't have any issues with contamination. I don't alter the breast in any shape and don't make any scars on the breast itself, just underneath. That scar, for most patients, you can't see it when they're standing up, and it's small. It's usually only about 1.5 inches long, and it heals really well. Now, that scar also has the lowest risk of complications, specifically capsular contracture, which is when people get a scar around their breast implant and it gets hard, and it kind of turns into a sphere, and it looks kind of strange. Now, there are 2 other incisions that people use. One is next to the areola, or in the areola. To do that, they have to kind of go through the breast tissue, meaning you have a higher chance of infection. Also, people do a transaxillary breast augmentation, where they make an incision in the armpit. Well, that incision I don't love because it's in a sleeveless shirt, it might be visible. Some people, if they didn't heal perfectly, they might be able to see it in just regular everyday life, so I don't really love that. So what's right for you? An augmentation, a lift, or a combo of the 2? So it really depends on your goal. So an augmentation makes the breast larger. It doesn't really have a whole lot of lift. Some people will say it can lift things a little bit. It's more of a change in the dimension of the breast, but nothing really lifts. A lift itself repositions the nipple, takes off extra skin, and creates scars. An augmentation with a lift combines the 2. So we're both adding volume to the breast, but we're also lifting the nipple position. We're taking off that extra skin to give the breast a more youthful appearance. Now, who needs what is kind of up to the patient and their anatomy and their goals. So in an augmentation, in somebody who's had multiple children, who has some sagging of the breast, that patient in the right person can have a good result if their goal is to look better in clothes. Now, their nipple position would still be low, but they would still have more volume in their clothes. If they wanted that nipple position higher, they wanted that more youthful breast overall appearance, then combining an augmentation with a lift at the same time is a much better surgery. What lift incision is needed? So it really depends on how much extra skin is going to need to come off and how far the nipple needs to move. The smaller the distance that the nipple needs to move, the smaller overall incision. Also, it depends on how much of the skin of the breast we're going to have to remove. So the greatest incision, the largest incision, is usually something that looks like an anchor. So it's a circle around the areola, a line down to the bottom of the breast, and then a line underneath the breast. It heals really well, but it is a reasonable amount of scar. Sometimes we can get a lift done with just a circle around the areola with a little lollipop type scar with an up and down incision. Occasionally we can do a circle around the areola, but you kind of sacrifice the scars, you sacrifice the result for the scar. Often in that setting, you do a circle around the areola, but often the areola spreads out over time, and it doesn't give you as good of a result as sometimes something that has much more of a lollipop type shape. What are some reasons for a breast surgery revision? The number 1 reason we usually get is somebody wants their implants out, changed, replaced, all of the above. So usually they've had an augmentation in the past and they either want a different size, they don't want their implants anymore, maybe they've got some capsular contracture and they want them taken out, maybe replaced, maybe not. Another big reason is for changing breasts after pregnancy. So maybe they had an augmentation in the past, now they want a lift on top of that augmentation, or they had children after they had a lift in the past and things changed after that pregnancy. Those are usually the most common reasons that we do a revision of breast surgery.